So starting your own telemedicine program, one of the first things you're going to want to do is try and decide what you expect out of the equipment. Are you going to be doing just patient consults? Would you like to do classes, continuing education, including meetings with far off sites? Is this going to be a fixed unit that's going to stay inside of one room? Do you want equipment that's going to roll around from room to room? Or do you need just a simple desktop unit for one person to use? By knowing these simple questions, it will help establish what kind of equipment you need, how much money you need to start off investing into the program. Depending upon the current service providers in that area, we can go with business class cable connection, which is very good, has lower monthly charges. We can use an MPLS clouded based connection, which are very good, managed by a service provider as well. Or even DSL in certain areas will also work. So one of the most commonly used lines that we've used here in the state are T1 lines. These provide 1.5 megabit per second up and down streams. That will allow you to provide better content to your far site or your customers, patients, students, whomever you're working with. So we go to a new site, we meet with the personnel there to determine what their needs are. Once we have the needs and decide what they want, then we'll look at existing connections, what you have, if it will meet your needs. If so, we're good. We'll order the equipment, we'll schedule an installation, get it set up, and then a follow-up training session. Generally, it takes about 2 months. Worst case scenario, about 2 months to get new equipment. We have gotten it done as quickly as 30 days. When we start up a new site, people are afraid of the technology, so they don't want to use it. But once we can get them to get past that initial fear, pick up the remote, play with it, call other people, get comfortable with it. Get comfortable with talking to someone over a TV. Once you get past that, your project will explode. And that's the biggest thing, is to drive your people to use it, to encourage them to use it. Let them have fun with it. Then by that, your content, if your patient care, your training will actually increase. Your people will become happier with using it. They'll become dependent on it.